Hi, everyone. My name is Katie Sharp. I'm a fellow in the Leadership in Preventive Medicine Fellowship. I'm also an internal medicine physician. And today I'll be talking to you about just in 5, what no one wants to talk about in medical training, depression in residency. Depression can affect a variety of aspects of your life. Your functioning at home with your relationship and everyday tasks. It can also affect your work with productivity and impair your ability to carry out everyday tasks and responsibilities. Physicians with depression are more likely to make medical errors that they wouldn't ordinarily make. And it can also affect your lifestyle, your ability to sleep, your ability to eat and make healthier choices surrounding food and exercise. This is really worsened by a variety of factors in medical training, especially residency and fellowship that are very busy. So residency is a busy time with high demands, high pressure, and minimal time for processing huge events. They're acute on chronic stressors and really not much time to process. I'm sure we all have had situations that have stuck with us at work that might be considered emotionally traumatic and have us feeling bad about it. And we're asked to move on to the next task without talking to our friends or our teams and really being able to process. In addition, we have to balance educational objectives, so balancing financial aspects of work, our friends, our family, our training, learning, and our lifestyle. So there have been studies that have looked at physicians in training and what is the prevalence of depression. And really, it's a staggering number, and it's very common in physicians in training. So there was a meta-analysis published that looked at about 18,000 physicians in training, and it was published in JAMA, and there was a staggering 20.9% to 43% of physicians in training screened positive for depression. It's really endemic among residents and fellows. This rate was higher than medical students and physicians who completed training, and it was higher than the general population. So this is a real concern because it can lead to things like physician suicide, which is also higher than the rates in the general population. For physicians, it's 1.5 times higher for males, and females, it's more than double. So in a survey that looked at interns, 24% of interns developed suicidal thoughts within the first 3 months of training. It's very common in medical training, so you should be aware of the signs in yourself or others and know that there is help out there. One of the reasons that physicians, residents, anyone in training don't seek help is because of stigma. In surveys, up to 50% of physicians were reluctant to seek professional help due to fear of exposure due to stigma. It can impair the ability to seek help. And stigma surrounding time. When do I take time away from my clinical care? There's really no time in the schedule. Really takes away from the ability to seek mental help if you need it. The good news is that there are some improvements with some progress, and there have been some changes offering mental health resources, especially during COVID. But many state licensing boards still ask questions regarding doctors' history of mental illness, addiction, or substance use on applications for medical licensure and renewal. Although a variety of different states, including Maine, have omitted or altered these questions to reduce stigma. I've included a resource in the resource handout if you want to learn more about how states have reduced stigma when they're talking about their boards. This can hinder people from seeking help. And again, I included resource in the resource section, including the wellness website where there is help that you can seek. And the good news is that mental health care is becoming more readily available and it's confidential. There are resources on our wellness website through Maine Health, which I included the resource. There's also Talkspace, which is accessed through Maine Health, and you can also find on the wellness website. And it's important to seek help and really reach out to others. And I encourage you, if you're having any thoughts or if you're feeling down or depressed, reach out to friends, family, other residents, trainees, mentors, or a mental health professional. There is help out there. I also challenge and encourage you to keep things that are important to you outside of medicine for your well-being. So find things that bring you joy outside of medicine to keep that work-life balance, whether it be running or reading or spending time with your friends or family. Keep things that are important to you. So I included a variety of resources that you can look through on depression, suicide, also resources for Maine Health if you're having any thoughts or feeling down or depressed or want to access any of the mental health resources. So thank you.